Hi, and welcome everyone to the ultimate egg freezing discussion. And thanks for being part of today's uh, talk. We have, first off, I just want to say a big thank you to the Reproductive Medicine Associates of Connecticut. Thank you so much for hosting this event. We have Dr. Spencer Richland, who is joining us. He's a board-certified reproductive endocrinologist with extensive experience in surgical experience and egg freezing since almost its conception. So you want to say hi,
Hi,
Dr.
everyone.
Richland?
Thank you for joining us.
And then we have Agnes Story, who wrote the How and Why book, Eggs Unscrambled. And she's the author, an executive in New York City with her own personal experience in egg freezing. So you want to say hi, Agnes?
Hello, everyone.
So we're just going to start today's discussion about, why egg freezing is important today. Dr. Richland, can you maybe give us a quick, brief history about how egg freezing first started and how we've gotten to where we are today?
Okay, well, thank you, Valerie. How I look at egg freezing is the first pregnancy and delivery from an egg freezing or from an egg that was frozen was in 1986. And what's really so exciting is that the ability to take an egg and freeze it, and the technology has gotten so good over the past many, many years. And as we sit today, in 2012, we all know that egg freezing is no longer experimental. And how I look kind of at the history of this is the technology of egg freezing is the following. What's so interesting is that the egg, the human egg, is a big egg. It has a big cell with a lot of water in it. And over the years, after we used to do IVF and harvest these eggs, and we wanted to freeze them, in the earlier technologies when we froze these eggs, since the egg has a lot of water, we used to freeze them and cause crystallization inside the egg. And when you make crystals inside the egg, those crystals are sharp and could be dangerous, and they in the past damaged the egg and the structures inside the egg, like the chromosomes. So what's really neat is now where we're sitting, we can do something called vitrification. And vitrification is a technology where we can freeze a set of eggs for egg retrieval within minutes. And those eggs can now be frozen. They're frozen without causing this concept of ice crystallization inside the egg. And when you do that, you have eggs that freeze rapidly into what we call like a glass structure. And these eggs are gently and safely frozen for later use. So where we are today is the technology of the field is vitrifying eggs, and now when we thaw them, which is when we want to use them, and we put sperm with them and we make embryos, our pregnancy rates are really, really good because those eggs were frozen gently, they're thawed gently, and now we have really, really good outcomes when we use these eggs, make embryos and put those embryos in the uterus and have pregnancies. So where we're sitting is in a great place in our field where we want, and we're going to talk about that, our patients to know we do this really well, and we want people to talk about it and know it's out there.
Right. So Dr. Richland, can you give the audience a little bit of understanding, like when they do freeze an egg, what's the chances of that turning into a live birth?
Good question. It really depends upon the age at what time the egg was frozen. So that's kind of the real crux of all this, is that you really want to, if you can, you would love to have your eggs frozen, as soon as you really want to do it. So that's step one. So we know the younger the eggs are, the better we do. Why? Because when we thaw those eggs and we put sperm with them, the younger the eggs are, the more chances that egg and embryo is now going to be chromosomally normal, or 23 pairs of chromosomes. So as our patients get older, more of the eggs, when we thaw them, are not going to make good embryos that are 46 chromosomes. So in general, we feel like we would love our patients to get, when they freeze their eggs, let's say if they're under 35, 15 eggs, and if they're above 35, more than 15 eggs. And then we put egg and sperm together and make embryos. I kind of feel, to answer your question directly, someone under 35, you would love to have around 15 eggs, because when you thaw those eggs and put sperm and make embryos, then you'd love to be able to have the chance to have a couple children. So it's age dependent.
Yeah, so I heard the statistics that between 2 and 12 or 12% each egg could turn into a live birth. Is that a pretty accurate
It's an accurate number. Again,
number?
it depends upon the age of the egg. So under 35, when we have those 15 eggs and we put sperm and make embryos, I would love, of all those 15 eggs, I'd love to have, about 8 to 9 embryos. And then each embryo has a chance of pregnancy about, 50 to 60 to 70%. So, you're right. You want a good amount of eggs because then you're going to have your embryos and then you're going to have the opportunity to transfer an embryo and try for pregnancy.
Right. So Agnes, let's dive into your story a little bit. You are very public about being an egg freezer. Do you want to share with us what led you to freeze your eggs?
Yeah, absolutely. So I froze my eggs after I actually sort of went the other direction, if you will. I went through what I call fertility treatment light with my ex-husband. We were married for about 3 years and spent the majority of that time trying to actively get pregnant, first without any real medical intervention, and then eventually we sort of moved up the ladder of medical intervention as it relates to fertility treatments, and it didn't work for us, and ultimately our marriage failed as well. And at that time I was about 35. And there was nothing wrong with me that the doctors could identify. And in fact, I ended up freezing a very healthy number of eggs. But I realized at that point that if it was difficult for me to conceive in my early 30s, that it was going to be increasingly difficult for me as I got older. So I decided then to freeze my eggs. And in addition to freezing my eggs, I also realized, wow, why aren't people telling women about this? Like, there is nothing wrong with me, and yet I can't get pregnant. Why isn't this a conversation that we're having more often and more proactively, and certainly much younger, so that you're not having the conversation once it's become a problem?
Absolutely, yeah. Agnes, did that lead into your writing the book, Eggs Unscrambled? Did that kind of like open the door for that?
It did. I remember thinking that, women should be talking about this. It shouldn't be this taboo conversation. We shouldn't hide the fact that, many women who are having children at an older age are probably having some sort of fertility help with that. And I just feel like even amongst my friends and my community, that was a subject that it was kind of sad. No one wanted to talk about it. So I wanted to take that out of it and just have a normal human conversation about it. So I started a blog and actually tracked my my very real adventures in egg freezing, from giving myself all of the shots to just sort of like writing about how I felt at that moment in time of freezing my eggs. And
right, that blog was called FrozenPlease.
That blog was called FrozenPlease.com. I have not kept that blog up to date just because the book took up quite a bit of my time, and I have a full-time job, but that blog was the reason that I ended up writing Eggs Unscrambled. A publisher took note of it, and she very wisely realized this is a very timely topic and something that no one's really talking about this way. I think before I wrote the book, there had been a couple of books on IVF and what it's like to conceive, and there was certainly a lot of talk about these egg freezing parties that were coming up, but most of the information was brought to you by doctors. Nothing wrong with that, but I thought it was time for a real woman to bring sort of the real human aspect of what it's like to realize that it's not as easy to have a baby as we're all raised to think, and what it's like to go through the egg freezing process. So the blog Frozen Please led into the writing of Eggs Unscrambled.
Right. And, Dr. Richland, Agnes was a primary good age to freeze her eggs, in which she took advantage of, luckily. What's your thoughts on that age component? You briefly touched on it, but I know you're pretty active in the online media with your website, Single Moms to Be. And are you seeing women come in older, or is there a shift now, a paradigm shift where?
What we're seeing, I want to make one quick comment. Agnes's book is fantastic. It really hits so many great points in what we do. Agnes, I loved your book. It was absolutely really great because it really talked about what you were thinking and your journey going through it. And I want to make a quick comment about that, and then I'll go on with you, Val. The real issue is that we have to talk about this and that, and we have to have our lady patients be open about the reproduction and really protect your reproductive potential. And that's the key, because the whole issue is that ladies' eggs were born with them all. Over the time, they don't want to behave. As we get older, men make sperm until they pass. So eggs, there's a premium on our eggs for our women patients. And what Agnes talks about is really the truth, that we have to talk about it. We have to protect our reproductive potential. We have to be open about it. And it's an open discussion. We don't want our patients people waiting too long, and then come in and freeze eggs when they're a little bit older. So to answer your question, we're seeing patients kind of all over. The reality is a lot of our patients are coming in 35, 36, 37, 38, 39, 40. And as we know, it's fine to freeze eggs at that point, but not all the eggs that they're going to get are going to be good and actually make pregnancies that deliver, because those eggs aren't going to be genetically really correct. And what we're talking
of that,
go ahead,
Dr. Richland, in the news, like Lady Victoria, she's one of the royals. She froze her eggs around 41 versus like Andy Dorfman or some of the Bachelorette girls, they're in their early 30s, or even like Rita Ora, who's a singer in the British or UK market. She froze her eggs at 20. So, like, where do we decide what age is good for us so we can plan?
I think it's an open. I'll hit first, and then Agnes, go right ahead. I think it's an open discussion. I think you got to talk about and think about. You got to protect it. Some of our patients, they're not ready for family building right now. They haven't found a proper mate. They're in school or they're doing career, and they know in their 20s. The discussion has to be, think about this, because in a simple 2-week period, you can freeze your eggs and freeze them, and then you can do other things, and you kind of know in the back of your mind, I have the hope and potential of those eggs to use them if I need to. I may never use them, but I may want to. So we're seeing our patients coming a little bit older, but I think as Agnes is talking about in her really cool book, this is something that, in addition to oral contraception and STD health that we learn when we're younger, we need to learn that there's a finite amount of eggs, and that, some of our patients are going to take their own personal control and say, something, I'm going to freeze my eggs in my later 20s or earlier 30s because they're mine. It's about me. I'm going to take control and protect them. And if I want to use them later, I can. If I don't, I don't need to.
Yeah,
is that kind of how you felt, Agnes?
Yeah, I would go probably even a bit more extreme, because I'm not a doctor, so I can say whatever I want. A lot of medical professionals will be a bit more conservative about when one should really consider freezing their eggs. But I would say, the minute you're thinking about it, if you are fortunate enough to have access to that kind of treatment, you should do it. I don't see the downside to it. And I think at the very least, what we should be doing as early as 18 and 20 is, when we go for our annual checkup, start to understand what your reproductive health looks like directionally, because there are some women who find out in their early 30s that actually they're potentially going into early menopause. And isn't that an easy thing to get ahead of in your 20s if you're going to the GYN on an annual basis anyway? So I would say that it's kind of a two-pronged or two-part question, which is, when do you start actually testing for certain things that are very easy to test for, so that actually I might run out of eggs at 30, and gee, it would be great to know that when I'm 22 rather than when I'm 29. Or then also be able to make the leap and say, I'm going to freeze my eggs at 25, because guess what? I know I'm not going to get married and I'm not going to want to have children or whatever your situation is until I'm 40. And so I don't know. I think the same way that we plan for our finances very early on. I mean, I remember my first corporate job in America. One of the first questions I was asked is, what 401k percentage do I want to contribute at? You start to get conditioned to plan and think about your future as early as 22 for retirement. Why wouldn't we treat fertility the same way?
Can I make a quick comment about that?
Yeah, go ahead.
One of the really neat things in Agnes's book, and I talked to her about it, is this concept when our ladies are in 9th, 10th, 11th, 12th grade, we talk about, in reproduction class, reproduction, the menstrual cycle, how to not get pregnant, and contraception. But what really needs to be happening at 17, 18, 19 is talking about reproduction, eggs, and kind of the reproductive potential of our patients and women. And what Agnes made an interesting comment in her book, she said, we talk about that a little bit when we're 17, 18, 19, but at the same time, people are taking history class and they're learning about history. And then they go to college, they keep on learning about different history of different cultures, and that's really cool. But no one ever talks about reproduction again. Mm-hmm. So that's the key issue, is to talk about it early so that, like Agnes said, we're going to have our patients freeze eggs in their 20s, which is absolutely fantastic. You know what I say to our patients? Your eggs are never going to be younger than they are today.
Yeah.
So if it's on your mind, like you said, Agnes, do it. It's 2 weeks. Do it, put them away, and you got them.
So Dr. Richland, what are some of the tests we can take that will help us know where we stand, the best tools that we have now in our toolbox to know a good time to plan for that?
So what I'm going to do is I'm going to kind of go on what Agnes was saying. And the truth is that a lot of people, when they go to their OBGYN, they don't spend a lot of time with them. And it's a quick visit. In our practice here at RMA of Connecticut, we outreach to a lot of our OBGYNs and we talk to them about ovarian reserve testing, because that's what it's really about. And kind of what Agnes was saying subtly is that you can do an ultrasound, look at ovaries and look at follicles, and you can do 2 blood tests. The easiest is the AMH, and that's a cool test because it's a blood test that can be obtained any day of the menstrual cycle, and it's a blood test that you get a number value. This hormone number value gives you an idea of kind of your reproductive health and, the thermometer of how good your eggs are. That is the quickest blood test. So I'm in agreement with Agnes. That test, your OBGYN or your RE can get it for you and give you an idea of your reproductive health. But here's the trick. We have to have our patients know to push their doctor to do it and walk into their GYN appointment when they're 21, 22, whenever they want, and say, I know you want to talk about all these other things, but I want to check in on my reproductive health. Talk about it, and they can get those tests, an AMH, and at least open up the discussion. So
yeah, I think we spend so much of our time trying not to get pregnant and being on birth control that we're not having that discussion with our OBGYN. So that's great that your clinic works with your referrals network to help advise that for women when they are younger. I think the word is definitely getting out there. Agnes, you were probably one of the first websites I stumbled upon when I started experience.com, and helping that network grow as far as giving the proper information, I think is very valuable. Do you want to dive a little bit more, Agnes, about your journey and how actually the egg freezing process was for you?
Yeah, I think, one thing that you guys were just talking about that really jogged my memory is I remember the first time when I realized, why has no one told me this? And I'm sure I learned about it at some point in the 9th grade, but, I was in my early 30s by then. I didn't, that's not what I was paying attention to. But my GYN was telling me about, the kits that you get to see when you're ovulating. And then she was telling me, then you have sex during those times. I was like, wait. Are you telling me that I can only get pregnant on 3 to 5 days out of the month? Are you serious? So why have I been popping birth control pills my entire life? So it was kind of like that moment where I realized how ignorant I was about my reproductive health. And, I'm not particularly ignorant about a lot of things, but in this case, I was like, wow, I can't believe that I didn't know that. And that level of just not knowing anything was what led me to start talking about it. And I found that a lot of my friends and a lot of my peer group, I think now, obviously, we're much more aware, but at the time, as I started talking to friends of mine who were around my age, they also sort of had the same reaction. And that's a pretty fundamental piece of knowledge that we need to have. And so that was the moment where I was like, wow, we really do need to talk about it. Hence the blog.
Yeah, education is kind of let women down a little bit about giving us the proper information that we need to know about our fertility. and our cycles even. There's a lot of women that don't really understand their menstrual cycle and how, day 1 through 7 is usually your menstrual bleed, and then day 10, 11, 12, 13 is an ovulation window, but not everybody ovulates at the same time, so you need to kind of, understand your own body. And so, yeah, I definitely think that you're not alone, Agnes. I've seen that in my friend group too. I'm sure, Dr. Richland, you've heard stories of this as well. And so when you did kind of come into that, Agnes, what was, and you started to want to try to get pregnant, and now you're in this realization that, wow, when you want to get pregnant, you can't. Where did that lead you? How did that go with actually freezing your eggs?
Well, I think, again, because of when I froze my eggs, first I tried to get pregnant and then I froze my eggs. I think that, the frustration with not being able to get pregnant is that, like a lot of women I know, I've sort of been able to do everything I put my mind to my entire life. So then to go, wait, the one thing that I kind of took for granted that I could do, I can't seem to do, is kind of a, I'm probably not allowed to curse, so I'm going to edit myself.
Humbling experience,
it was a
right?
bit of a mind blow. I was like, wow, this is insane. We've been told for so many years that, be careful, don't get pregnant. You wouldn't want to get pregnant too early. And then you realize it's actually not that easy. So that was definitely an emotional and psychological moment in my life where I was like, wow, I can't always do everything I want. But then I think freezing my eggs sort of gave me that, I don't want to use the word control back because I don't know what's going to become of those eggs, but it gave me a sense of like, I'm now doing something about this, and I am now protecting my fertility and my potential to get pregnant later in life. And I think really I learned so much about my cycle during the egg freezing process because it's so precise and so timed, and you kind of understand what's happening with your hormone levels on any given day. And I think what I found really kind of surprising about the egg freezing process is how easy it was. And I'm not saying that because I'm trying to sell people to go freeze their eggs. It was just really surprising to me. And I didn't know, even though I had gone through fertility treatments, I wasn't sure exactly what the egg freezing cycle was going to look like. And I was a bit intimidated by that because you don't really understand it until you start going through it. But once I did, I realized it's actually just a manipulation of the first half really of your menstrual cycle, because all you're doing is pumping yourself full of the same hormones that you already produce to make sure that you have as many follicles mature as you possibly can. And then when you would normally ovulate, those mature follicles and eggs are surgically removed, and the shots were a lot easier than I thought they would be. Knock on wood, my body reacted exactly the way it should. I ended up laying 32 eggs, freezing 28 of them. So I probably kind of overreacted to the drugs and the hormones. But I was very pleasantly surprised at how simple and easy the process was. And when you go to a good clinic, they really sort of hold your hand through the entire process. So, they're taking your blood work every other day, telling you what your hormone levels are, and telling you exactly, what you need to give yourself in terms of the shots.
Yeah, Dr. Richland, can you talk a little bit about the protocol at your clinic and how you're stemming patients and what those hormones are doing to the body?
Yep. So I agree with Agnes. It's easy and it's pretty quick. So here's how I kind of look at it. In order to do an egg freezing cycle, what we do is we have our patients call us on day 1 of their period. So day 1 of their period is real flow. They come in on day 1 of real flow. They come in on day 3. And on day 3 is when the ovaries have the little follicles. They're about 5 millimeters, and there's eggs in them. And the ovaries are quiet, and she just had menses. And then what we often will do is on day 3, we can put our patients on birth control pills, believe it or not, for a week, and kind of cool her ovaries down. We can order the medicines that Agnes were talking about, which are called gonadotropins, and teach how to use them, how to use the injections. It's a little sub-Q shot that goes near your belly button. It's kind of simple. So we use that week to kind of cool the ovaries down, order medicines, teach you how to use them. And then after that week of pills, 2 days later, that's when we start taking shots every day for about, let's say 9 days. Agnes said it was fine, and in her book she comments that she felt that it was completely doable. So you take the shots 9 days. During the 9 days, we're going to see you 4 or 5 times. And what we're doing is we're watching the small follicles, which are 5 millimeters, grow to like 19, 20 millimeters over those days. Each follicle has an egg in it. We're measuring your hormone levels because that can help us adjust your medicines. And usually after 9 days, us seeing you 4 times, you're ready after 9 days. 36 hours later, you do your retrieval. Now your retrieval happens with IV sedation. Within 10, 15 minutes, we'll remove all of the eggs. And during the retrieval, people do not feel anything. The truth is afterwards, and Agnes, you may agree, and I know you stimulated really well. Afterwards, some people can it can be painful. Some people go to work the next day. It's doable. And then what we do is we take those eggs on the day of retrieval, clean them up, and that will tell us how many of them are mature and they get vitrified. And those eggs are then placed in individual straws, and they're vitrified, they're labeled, they're in nitrogen tanks, videotaped and generator backup, and just ready to be used whenever you want. So it's quick, it's doable, and Agnes made a good point, and it's one of the points I wanted to say. If you're a good center, people they're gonna hold your hand. They want to see you succeed. They're gonna help you along with it. They're gonna support you, and you can do it. And it's 2 weeks, and then you have them. So it's pretty doable.
Yeah, it is a really nice backup plan. I mean, I froze my eggs twice personally, and have 29 frozen. So I feel like that's a really good. It's not a security. It's like a security blanket, but not guaranteed, but definitely a better option than having nothing. At least you're doing something proactive for your reproductive future. Agnes, was there any piece of that puzzle that was hard, or anything that you struggled with? Was there any emotional components that you felt like you had to overcome, or any physical components during the egg freezing?
There were both. I mean, I think for some people, egg freezing is like, it's not a big emotional thing because they're just putting their eggs away just in case, and so they go through it and it's fine. For me, I was coming out of a marriage and I felt like I was freezing. I think I say this in the book. I felt like I was laying eggs when I should have been having babies. So, for me emotionally, it was a little bit of a different journey than if you do it in your 20s before you've ever been married, never have tried to get pregnant. So there was definitely the emotional component, and at points in on the blog especially, and in the book, I talked about the fact that I almost wanted to sort of change my mind and just complete it and go through IVF instead of egg freezing. So you were
thinking about being a single mom by choice?
I mean, I was thinking about it, but kind of irrationally in that moment in time. I was hopped up on hormones, and again, just coming out of a marriage at that time. So that was sort of like in the back of my mind what was going on, but knew that was probably not the right decision in the moment. But I had sort of that emotional baggage to work through. I think physically it was actually all fine. I mean, I was very, very bloated towards the end. The shots didn't hurt. I actually talk about having my estrogen levels that high. I don't know. I kind of felt great. I felt like, I don't know. It was almost like, how some women are glowing when they're pregnant and other women are not so great when they're pregnant. Yeah. I felt like, wow, give me this estrogen all the time. I actually feel great. I had a really hard time with it afterwards, though. I think I had a lot of eggs, and so I had a bit of ovarian hyperstimulation. And it was managed and controlled, but I definitely didn't feel great. I also had a reaction to whatever it is, whatever the sedation was. So I struggled much more so afterwards than I did during. And it took me probably 2 to 3 weeks to fully recover, but that's unusual. That's not the normal. That's not the normal case. And I even with having struggled for a couple of weeks afterwards, I have no regrets.
Dr. Richland, is there any key things that we can do to kind of prepare for recovery? Is that what you're hearing and seeing with your practice?
I think Agnes's point is well taken. Is when you're stimulating, if you really, really do well, about 1%, 2% of people can have what's called ovarian hyperstimulation. That's when you make a lot of eggs. Your ovaries, they start off small. They can get big. You can get pain, pressure, and you can also have fluid accumulation in your abdomen. So what we do on our side is we really want to prevent people from stimulating too much, but we also want them to stimulate well. So it's kind of a tightrope act. So we have different tricks up our sleeve to try to stimulate people well, get a lot of eggs, and hope and manipulate so they don't get ovarian hyperstimulation. But it can happen. It happens, and it's out there. I think one of the other things is we try to get our patients ready to freeze their eggs before they even do it, which is also important. So when we're having people who are really thinking about doing it, we talk about it, like we talked about, we'll do an AMH, look at a follicle count. We have a lot of people that talk to them. We have cool reproductive coaches here. And also some of our patients are starting to eat well, exercise, and kind of get themselves really into the mood to do it. And then they do it. So, it's a process where we really want it to be done safely.
Yeah, and I think we also need to have in perspective that there's many different ways and paths to parenthood. I recently started an egg freezing focused podcast called Eggology Club. And Agnes, thanks so much for joining one of our shows, episode 6 for anyone who wants to listen to season 1. She talks about dating and kind of like the aftermath after freezing your eggs and what that's kind of led you to do now. What is your update, Agnes, on your book? Where are you kind of at now? Are you still promoting it, or your headspace?
Yeah, I mean, in terms of the book, I'm promoting it to the extent that I get asked to do events like this quite a bit, and I love doing them, not just because of promoting the book, but it's a topic that's still near and dear to my heart, and I do think that women need to be thinking about this and thinking about it earlier. So that, that's sort of my level of promoting, is kind of getting the right group of women together to talk about it. I'm always up for that. I loved being on your show. You guys are a great, and it's so relatable, and just chatting with you guys, it felt like almost just a conversation that was being
with our girlfriends,
recorded,
right?
with our girlfriends, yeah. And I thought you guys had, really great questions on like dating after egg freezing. And I think everyone has a different take on that. For me, I think, I had a couple of epiphanies during that time. And, you get to a certain age, and I think that there is a sense of like hurry and rush and, oh my God, is this the one? Can this person be my baby daddy? And I think once you freeze your eggs, and once you come to terms with the fact that families are in different, come in different shapes and sizes these days, you kind of can think about doing it on your own, or you're less in a hurry because you have eggs on ice, and suddenly dating is no longer about a series of interviews for who might be your future husband or your future baby daddy, and just more something that you can enjoy the same way that men enjoy it. So that kind of continues to be the way I view the world and think about things. And I think that the other thing I talk about in the book is when you have a moment to think about what you really want, you might realize that motherhood may not be for you after all. I interviewed a couple of women who actually, after they froze their eggs, that gave them a moment where they were no longer battling their biological clock. And so they were able to say, actually, I don't know if I want to be a mom, and I don't have to make that decision right now because I have my eggs on ice. It also gives you a moment to contemplate, like, if I do become a mom, maybe I want to do that on my own. So I think it gives you so many more options than simply having eggs on ice.
Yeah, you're right. It's like we are giving ourselves the freedom to have a little bit more time to digest and make the best decision for us, rather than rushing into maybe a relationship or a situation that may not be a good fit.
Yeah.
Speaking of the future, Dr. Richland, what do you think is going to happen to egg freezing like in the next 5 years, or like where do you see it going in the future of it?
I think where it's going is people like Agnes and all of us who are really interested in this and who want to talk about it and want to have options open. I think the reality is that we're going to have a lot of people freeze their eggs. So many people are doing contraception and taking oral contraceptive pills, but why aren't we talking about freezing eggs? It is easy. It's so here. We're doing really well in it. And so from my aspect, I just want people to know about it. I'll tell you how dear this is to my heart. So for example, sometimes we'll do events where we'll have our patients come, whoever wants to come, and I will talk about, just like you said, Val, reproductive cycle, when to get pregnant, all the subtleties of reproduction, because no one teaches any of us this stuff. And then we'll also sometimes do a free AMH for anybody who wants to do it. So they can do an AMH, and then they can kind of check in with the reproductive potential. So I think that the physicians need to talk about this earlier. The reproductive endocrine people, we need to teach our obstetrician physicians to talk about it and bring it up. And I think more people are going to be freezing their eggs to keep options open and take control of the reproduction. And I think it's going to be fantastic. We just have to get everyone to know and to be free about it.
Yeah, that's a great point. I think that once we kind of break down some of those stereotypes and we realize that it's not shameful that we have to freeze our eggs, doesn't mean you're giving up, doesn't mean that you're a loser. It actually is your stock just rose in my book. I mean, you now have saved yourself so much money because maybe it's for baby number 2 or baby number 3. Maybe it's not for baby number 1. Maybe baby number 1 will happen very naturally and organically with a partner. But at least it gives you more options to be your own egg donor, so you don't have to battle some of the genetic or biological factors that come at a later age, like around 40.
Val, I agree with everything you said. I think what you said is exactly what it is. It is so simple, and it just gives you so many options. And you want to. It's so dear to our patients, their reproductive health. Let's just talk about it. And if you're into it, and you want to protect yourself, you can do it. Do you want to know about any questions we got?
Yeah. Do we have any questions?
Can I throw you a question?
Sure.
Okay. So I'm going to read my team wrote them down for me. Let me throw one. Has egg freezing taken the pressure off as you date again? Does it quiet the drive? That's one question. I'm going to say another one. I don't want my daughter to know how hard it is to get pregnant. Not that hard, but it can be. But I do want her to be aware of her reproductive health. How do we balance that? And then our last question, and then we can pick or choose, was how can we change the conversation and destigmatize this topic for each stage of life, like in your 18s, 20s, 30s?
Yeah, those are great questions.
Some feedback we've gotten.
Agnes, did you want to answer any of those?
Where do we want to start? What was the second question? Oh, the second question around I don't want my daughter to know it's hard to get pregnant, but how do we balance that? I mean,
how to know about her reproductive health.
Yeah, I think that goes back to the point that you raised that I write about in the book, and comparing it to sort of what we teach kids in middle school and high school is kind of the foundation of things. So just like, in history, you're taught one version of American history, and then you go to college and you're often taught the whole truth about American history. I think obviously in middle school, especially in high school, sex education needs to be pretty focused on preventing STDs and preventing premature pregnancy, definitely. And I'm certainly not suggesting that we sort of change the conversation there, but I think we have to complete the conversation. And then the question becomes, where do we do that? Because not everyone goes to college, not everyone sort of goes through the same curriculum. So where do we have that? How do we balance that out? It could be parents, it could be doctors, but I think it's just about making sure that the full curriculum is fulfilled and not just half of it.
Just piggybacking off of that, Agnes, I think that, when we're in 5th grade, we learn about our bodies and we learn about our reproductive system and how to use a tampon, for example, and that's probably an appropriate age to do that.
Yeah.
And then, when the high school years come and people are becoming sexually active, that's when we really need to have the conversation about STDs and protecting yourself, how not to get pregnant, birth control, all those scenarios. And then I think, after high school, we need to have a very serious thought, whether that be in our college years or our early professional life or with our doctors, our OBGYNs that we're seeing on a regular basis, about how are we planning for our fertility future, just like we plan for our 401k, like you mentioned earlier.
Yeah.
I think that's a really good point. When we were talking about the first question, the first one was about age, right? Wasn't it? Or
one of was, how do you date?
Yeah. At different ages with that. I think, check out Eggology Club podcast, episode 6, where we were talking about the 50 Shades of Fertility with Agnes, because she had some really great dating tips on, how not to interview for your baby daddy, but how to, make dating fun so you can relax and be your best self. And I think that was some really great information for people to take away. So you ask the right questions, and so you date in a way that makes sense, rather than feeling rushed that this is my only partner and I don't want to start over because now I'm in my mid-30s. I think that was a really great takeaway. And then
and I think egg freezing naturally takes that pressure off, right? And if it doesn't, then why have you done it? Like, I mean, part of the reason to do it is to buy yourself some time.
Yeah. And then the last question, what was that?
Last question was, how can we change the conversation to destigmatize a topic at each stage of life? So if someone's in their 18s, 20s compared to their 30s.
Right.
No, it's kind of going along with what Agnes was saying, and then I'll tackle that question. I'm trying to work on where my son goes to college. I've contacted the biology department to see if they're interested in having me come talk about reproduction, because that's really, I think, what we're talking about, is that reproduction is not talked about, and we don't all understand reproduction. And so I'm working on a symposium to talk about everything we're talking about now, because let's talk about it.
Yeah, I love that. That's great.
The age thing, destigmatizing, there's no stigma. The bottom line is when you want to freeze your eggs, you freeze your eggs. When you feel like you just go for it. When you're younger, Agnes said, that's kind of interesting, but the truth is that we have to talk about it. And some patients and some people are going to say, I want to do it. It's best to do it when you're younger. And when you're in your 30s, that's maybe when you thought about it. That's maybe when it came on your plate. And if it is, that's perfect time for you. So just do it. If you're thinking about it in your 30s, like, I'm wondering about this, what would I say? Talk to your doc. Be proactive, like Agnes talks about in her book. Just ask the questions. Go to a reproductive specialist. Check your AMH. Talk about egg freezing, because your eggs are never going to be better than they are today. And you can freeze them, like Agnes said, then you'll move on.
Right. Agnes, do you just want to give a quick shout out about how we can get your book and your social media handles?
Yeah, you can get my book on Amazon. Thank you, Val, for always reminding me to promote my book. You're better at it than I am. And my social handles are Twitter is AggieFish, and Instagram is AgFish.
Awesome. Great. Well,
I want to put a quick shout out. I would tell any of our patients and anybody who's watching that if you're thinking about egg freezing, you should read Agnes's book. I loved her book, and it's absolutely right on. Absolutely fantastic. And I'm rmact.com, and Spencer Richland and Reproductive Medicine of Connecticut.
Awesome. Great. Well, this has been such a great discussion. Thank you so much for everybody that's watching. And if you have any questions, please leave comments below. We will get back to you. And don't forget to check out experience.com for a load of resources about egg freezing, all about egg freezing. And then the podcast Eggology Club to hear more about how you can make egg freezing part of your life and plan for it. Thanks, everyone. Have a good evening.
Good night.
Good night.